Welcome back to our discussion on eating fish, taking a fish oil capsule, or taking a krill oil capsule and the benefits for your brain. There's a very large body of evidence supporting what I'm saying here. Eating fish, taking fish oils, taking krill oil, they really have a number of benefits for the brain. In part one of our discussion, I discussed eating fish or taking fish oils. And I prefer krill to fish oils because I do think that krill has additional benefits because it has a number of other ingredients in it. And I also think it has a number of advantages over fish oils. But don't get me wrong. I think taking a fish oil capsule is a superb idea if it's a high-quality pharmaceutical grade enteric-coated fish oil. I went into my thinking in the previous episode. So welcome back to our episode. Welcome to our today's episode, Fish Oils, and Krill for Brain Health, Part 2. Hi, my name is Jerry Hickey. I'm a licensed pharmacist who also has studied nutrition. I'm over here at Invite Health. I'm also the scientific director. And I'd like to talk to you today about how krill oil has pretty unique constituents that offer a number of benefits for your brain. Please be sure to subscribe to the Invite Health podcast today, and please leave us a review. You can also follow us on Facebook, Twitter, and Instagram at Invite Health. All of the information on today's episode will be linked in the episode description, and you can visit invitehealth.com/podcast for more information. So let's get started. I always like to lead with some studies, and today's no exception. Now, our krill oil has been used in many human clinical trials. It's from Norway. Norway is the manufacturing country. It's Rimfrost krill oil, which is very clean, very high quality. It comes from a part of Antarctica where it's very, very clean. The waters are superbly clean. And there's plenty of krill left over for those huge sea mammals like the blue whales. So our krill is super high in phosphatidylcholine, and that's one reason why I picked it, and I'll go into what that's all about later in the show on this episode. Here's a study from the American Journal of Clinical Nutrition, July 30th, 2019, and they looked at 2,500 men between the age of 42 to 60. At baseline, they had healthy brains, and they followed them for a 22-year-long study. And they found that a high intake of phosphatidylcholine, and I'll get into this, this is a very important ingredient in krill oil. Intake of phosphatidylcholine reduced the risk of all dementias by 28%, highest intake versus lowest intake. Now, in the journal Neuroscience Research, August 21st, 2019, research from Central Michigan University, krill oil is better than fish oils for the brain. A lot of it has to do with the phosphatidylcholine content. The fish oils are attached to phosphatidylcholine. Both of these are extremely important for your brain. They're both very active in the brain. And I'll develop this throughout this episode because there's a lot to say about this. They decrease inflammation in the brain. They improve spatial memory. You know where you are. You know where you're going. They improve your ability to learn and remember. They reduce memory loss that's connected to aging. They improve symptoms of depression, and they're better absorbed than typical fish oil capsules. So in the journal Nutrients, Boston University School of Medicine, phosphatidylcholine containing EPA and DHA. EPA and DHA are the oils in fish oils. Phosphatidylcholine is how they're delivered in krill oil. You do not get phosphatidylcholine in a fish oil capsule. You get it in krill oil. Phosphatidylcholine containing fish oils are decreased in the brains of Alzheimer's patients. And a high level of phosphatidylcholine intake is associated with higher memory performance and resistance to cognitive decline in older people. Phosphatidylcholine is how the fish oils in krill are delivered. Typically in a fish oil capsule, the fish oils are attached to triglycerides. And that doesn't shield them from your digestive juices. So you don't absorb them as well as you would think. In the krill, the fish oils are attached to phosphatidylcholine, and this improves their absorption. It protects them from your stomach acids, the pepsin and the hydrochloric acid. It protects them from the enzymes released in your duodenum, the first part of your small intestine, and it improves the efficiency of their absorption. But that's exactly how they exist in your eyeball for good vision and in your brain for a healthy brain. The fish oils exist attached to phosphatidylcholine. Very important. Here's the journal Alzheimer's and Dementia. It's published in New York. And it's from the Department of Neurology, University of Texas Medical Branch in Galveston. Comparing Alzheimer's disease brains to healthy brains. Now, this is post-mortem. There's an increased breakdown of phosphatidylcholine. So it's really, really important for the brain. So in the American Journal of Clinical Nutrition, there was a study from researchers throughout Finland, different academic research institutions and medical institutions in Finland, looking at 2,500 men between the age of 42 to 60. They had healthy brains when they were first enrolled in the study. The study enrollment was between 1984 and 1989. They then followed them for over 22 years, and 337 of the men were eventually diagnosed with dementia over the 22-year period. When they looked at choline intake, I better explain what choline is. Choline is a B vitamin. And you can get choline as choline, like choline bitartrate, or you could get choline as phosphatidylcholine. So looking at choline intake, regular choline did not protect the brain from dementia, but phosphatidylcholine reduced the risk of dementia by 28%. If you took in a good amount of phosphatidylcholine, you can get that in egg yolks. However, there is cholesterol and saturated fat in egg yolks, but there's a lot of healthy stuff in there too. I mean, having an egg here and there is good food. But you get a lot of phosphatidylcholine in our krill. I actually picked the rim frost krill because there's such a high phosphatidylcholine content in there, the highest I could find. So a high intake of phosphatidylcholine, that form of choline, reduced the risk of dementia by 28%, whereas regular choline did not reduce the risk of dementia because it doesn't get into the brain as efficiently as phosphatidylcholine. Now, as far as memory, both the choline or the phosphatidylcholine improve different aspects of memory and cognitive functions. So both choline or phosphatidylcholine were good for memory and cognitive functions, but only the phosphatidylcholine reduced the risk of dementia. So that's an important finding. What's so great about phosphatidylcholine? A zillion things, literally. Phosphatidylcholine is one of the rate-limiting factors for creating acetylcholine in the brain. Acetylcholine, phosphatidylcholine. So phosphatidylcholine gets into the brain more effectively and efficiently than regular choline. And then the phosphatidylcholine allows the choline to become acetylcholine. And that's really, really key to many of the benefits of krill. Before we go on with this conversation, let's go to a quick break. Jerry Hickey for Invite Health Podcast. We'll be right back.
This podcast is brought to you by InviteHealth.com. For over 20 years, Invite Health has provided premium quality supplements and expert advice you can trust. Now, first-time customers can enjoy an exclusive offer. Visit invitehealth.com/podcast or click the link in this episode description. That's invitehealth.com/podcast for your exclusive offer on Invite Health products. Invite Health offers the resources you need to make important decisions about your health. Chat live with degreed healthcare professionals, get product information, and find retail locations near you at invitehealth.com. You can also learn about our new genetic testing program and our exclusive Invite Fitness Wellness program. Follow Invite Health on Facebook, Twitter, and Instagram, and be sure to subscribe to our podcast today. Now back to our episode.
Okay, welcome back. Acetylcholine is a very important neurotransmitter in the brain. We know of about 100 neurotransmitters that function in the human brain. They make the brain work properly. You release certain neurotransmitters at key times. For instance, if you get off the wrong exit on the highway, you'll release different neurotransmitters in a way that lets you solve the problem. For instance, you'll release norepinephrine to focus on the issue. You'll release acetylcholine to solve the problem, and then you'll release dopamine to act on the solution. So you got off the highway, oops, I'm confused. Norepinephrine helps you focus on the problem. Acetylcholine solves the problem, and then dopamine gets you back on the highway going in the right direction. So these things are released at the appropriate time. For instance, you release serotonin to lift your mood, click your mood up. You'll release serotonin at night. It's converted an extra step into melatonin so you could sleep at night. You release serotonin near the end of meals so you stop eating because it helps control your appetite. You release norepinephrine to focus on something. You release dopamine to figure out if something is dangerous or safe or good for you. So all these neurotransmitters are extremely important. Acetylcholine is key to learning. When you're learning something, you release glutamate to activate the memory cells. Then you release a relaxing neurotransmitter called GABA to open up the memory cells. And then you release acetylcholine to push the memory into that cell. And when you want to retrieve that memory, you release the same neurotransmitters to retrieve the memory. So acetylcholine is needed for learning and retrieving memories. But it does more than that. It also allows you to solve problems, but it also repairs your brain. There was a number of studies now from different academic research institutions in the United States that taking drugs that have an anticholinergic effect is bad for your brain. So what's a typical drug like that? Well, a lot of drugs have a small level of anticholinergic activity. But some drugs, like antihistamines for allergies, or drugs for urge incontinence, have a very large component of anticholinergic activity. And this causes things like constipation, dry mouth, increasing eye pressure, preventing you from sweating and adjusting your body temperature, but also blocking the formation of acetylcholine in your brain. Now that's a problem. Acetylcholine is needed to heal the gray matter in your brain where your memory takes place, where your judgment takes place, where problem-solving skills take place. So if you're taking these drugs on a daily basis, every day you're releasing less acetylcholine. That means you're not replacing brain cells, you're not repairing your brain. Eventually you're losing brain cells, eventually you're losing memory. In other words, these drugs, because of their side effects, they don't want these effects, the drug companies, but they're side effects of the chemical structure of the drugs. Because of their anticholinergic effect, over time they're going to damage your memory. Now, the problem is acetylcholine naturally drops with age. Even the smartest Harvard medical doctor and the smartest Princeton physicist, they have a drop in acetylcholine, but they're so smart we wouldn't even notice. But all of us have a drop in acetylcholine with age, and it's one of the reasons why we develop that normal forgetfulness, absent-mindedness. It's not a terrible thing. But when you take these drugs, they compound the problem. It's a real issue. So when you get the krill, you're getting the phosphatidylcholine that gets into the brain better than acetylcholine. Excuse me. When you take the krill, you get the phosphatidylcholine that gets into the brain better than regular choline, and then it donates the choline to create acetylcholine for learning, memory, and the upkeep of your brain. So here's a study in the American Journal of Clinical Nutrition. It's from Boston University School of Medicine. And they're talking about choline. They say choline is a B complex vitamin. Now, the thing is, choline is water soluble. You need to get choline every day. And about 90% of Americans do not get sufficient choline intake for their brain health. You also need choline for your muscles to function, like your heart muscle. You need choline for your nerves to function. And you need choline to prevent fatty liver. A lot of adults today are walking around with fatty liver. We did an episode on that. I believe it's called fatty liver, the most common disease you've never heard of. And in other words, choline is a precursor to acetylcholine, the brain chemical involved with your memory and healing the brain and solving problems, etc. Acetylcholine is really key to brain health. And it's basically non-existent in the brains of Alzheimer's patients. But in all of us, it drops a little bit. I'm not concerned about developing Alzheimer's, but I'd like to keep my acetylcholine around. So a team of researchers from Boston University School of Medicine analyzed data on almost 1,400 adults. They were taking part in a long-running Framingham study. They underwent a series of memory tests and cognitive ability tests. They also underwent these very powerful MRI scans of their brain, functional MRIs. And they found that men and women with higher choline intake perform better on memory tests than those with lower intake. They also found something else. This is really important. A very important finding. People with higher choline intake at the outset of the study were less likely to show areas of white matter hyperintensities on their MRI brain scan. Well, let me explain what that is. White matter hyperintensities are in the white matter of the brain. The white matter is basically the insulation for your gray matter. Your gray matter is where your memory takes place. But it's also basically your internet, your wiring for your brain. And when there's damage in the brain, it expands and travels through the white matter. And they call it white matter hyperintensities. So they found that people with a greater intake of choline from whatever source had less damage in their white matter. That's a key finding. That's very important because, like I said, damage travels and grows and spreads through the white matter. It is a lot to this choline. So here's a review for NANES. NANES is the National Health and Nutrition Examination Survey. They get a lot of research out of this. They get a lot of information out of this. And they found that 90% of Americans don't get enough choline. They do not get enough choline. Let me just tell you something how important choline is. It's needed in the developing fetus for the baby to develop a head and a spine and a brain and a face. And if the mother lacks choline, the baby can have birth defects. It's not just folic acid that they talk about. They talk about folic acid all the time for birth defects. Choline is also important to prevent birth defects. So krill oil has additional benefits versus fish oils, but it also has a number of advantages. Now, the advantages over fish oils is better absorption because the fish oils are attached to phosphatidylcholine. It gets it past your digestive juices better. You absorb more of it intact. It's not broken down. But our krill oil is also the freshest source of fish oils you could get on the market. That's why I picked Rimfrost krill oil. It's just extremely low in lipid peroxides. They're non-existent in the product. And we also use a capsule. This is a pescatarian formula. We use a capsule made out of fish gelatin because it seals off oxygen. The oxygen can't get at the krill oil and oxidize it, make it go rancid, make it go bad. It stays fresher. But the fish gelatin capsule, this is a pescatarian formula, the fish gelatin capsule also improves the absorption of the krill. You don't get fish burps from krill. There's no mercury issue with krill. And the fish oils are already in the bioactive form, the form that's used by the heart, the form that's used by the brain, the form that's used by the retina of the eye for good vision. In other words, in a fish oil capsule, the fish oils are typically attached to triglycerides. So when you take a fish oil capsule, unless it's enteric-coated, a certain amount of it is damaged in your stomach and small intestine by your digestive juices. And what's absorbed is absorbed as fish oils attached to triglycerides. They have to go to the liver first, and the liver removes the triglyceride from the fish oils and attaches phosphatidylcholine to it. In the krill, you're already getting the fish oils as phosphatidylcholine. And our krill, just to say it, it's research verified. It's been used in quite a few human clinical trials. Now, what are the additional benefits of krill oil over fish oils? And once again, fish oils are a great supplement. They're a great supplement. In the krill, you're getting the phosphatidylcholine so you can make acetylcholine to repair your brain, for learning, for remembering, for solving problems. But you're also getting astaxanthin. Astaxanthin, when flamingos eat all those little zooplankton in those lakes, they have astaxanthin in it, and that's what turns the flamingos pink. Little flamingos are born very white. And that astaxanthin is a very powerful antioxidant that reduces inflammation. and it's absorbed right into the brain. See, the brain has additional coatings, insulation in the blood vessels in the brain that keeps things out of the brain. But the brain accepts astaxanthin. And astaxanthin gets into the brain, and it literally gets inside the brain cell. Most antioxidants work outside the brain cell. Astaxanthin gets right inside the brain cell and cleans the free radicals out of the brain cell. In other words, helping shield your brain as you grow older as an antioxidant. That's important. That's an important point. There's a major antioxidant enzyme in the brain, superoxide dismutase type 1 and 3, that shield the brain from all the energy use. There's byproducts of energy use that can kill brain cells, lipid peroxides, hydrogen peroxides. So the brain has this superoxide dismutase attached to zinc that shields the brain cells from all this peroxide. Problem is that really starts to drop in your 50s. By the time you're 60, it's almost gone. By the time you're 65, it's gone. So when you take the krill oil, you get astaxanthin, which can kind of step in and take over for your lack of superoxide dismutase type 1 and 3 and help shield your brain from the aging aspects, from the damaging effects of the free radicals in the aging brain. Now, krill oil creates plasmalogens. That's really important for the brain. I just mentioned that antioxidant levels drop in the aging brain. Before we go into this, let's just take another quick break. We'll be right back. Jerry Hickey for Invite Health Podcast.
This podcast is brought to you by InviteHealth.com. For over 20 years, Invite Health has provided premium quality supplements and expert advice you can trust. Now, first-time customers can enjoy an exclusive offer. Visit invitehealth.com/podcast or click the link in this episode description. That's invitehealth.com/podcast for your exclusive offer on Invite Health products. Invite Health offers the resources you need to make important decisions about your health. Chat live with degreed healthcare professionals, get product information, and find retail locations near you at invitehealth.com. You can also learn about our new genetic testing program and our exclusive Invite Fitness Wellness program. Follow Invite Health on Facebook, Twitter, and Instagram, and be sure to subscribe to our podcast today. Now back to our episode.
Okay, welcome back. I'm talking about plasmalogens. The best source to make plasmalogens is ocean scallops or krill oil. Plasmalogens are alternates to antioxidants. And I just mentioned that antioxidant levels drop in the aging brain. So byproducts released from energy utilization, don't forget your brain is a super high energy organ, all the byproducts from energy utilization that are damaging are free radicals. They can inflame and kill brain cells. So your superoxide dismutase type 1 and 3 have dropped in abundance. The astaxanthin in the krill helps take over for that, but the krill directly creates plasmalogens. The glycerophospholipids and the choline and the fish oils combine in your brain to create something called a plasmalogen. So what is a plasmalogen? Plasmalogens are found in different tissues like your muscles, your bones, your heart, but in abundance in your brain. And they're kind of like a bulletproof vest for your brain cell. When antioxidant levels drop, if there's sufficient plasmalogens, they absorb the free radicals and prevent them from destroying your brain cells. So krill has a number of benefits that you can't get from a fish oil because fish oil lacks the phosphatidylcholine required to create these plasmalogens. But krill also does a great job of stimulating the glymphatic system. Now, fish oils do that also. So although fish oils can't create plasmalogens, they can stimulate the glymphatic system. So what's your glymphatic system? It's the ability of the brain to break down toxic proteins and remove them before they build up. This generally happens in deep sleep at night, non-REM sleep, delta wave sleep. That's why it's so important to sleep 7 or 8 hours every night, so you can cleanse your brain, detoxify your brain. Both fish oils or eating fish or taking krill oil stimulate the glymphatic system to work better. But krill has the added advantage of supplying glycerophospholipids. Now, this is really important. It helps maintain the structure of your brain cell. In other words, it helps prevent decay in an aging brain. Glycerophospholipid levels, just like fish oil levels, drop in the aging brain, and brain decay can happen more frequently at a higher level. For instance, now they're looking at tauopathies as a possible solution for Alzheimer's treatment. Tauopathies basically is decaying brain cells. When you take the krill, you get the glycerophospholipids that help maintain the structure of the brain cell and help prevent decay of the brain. And just like fish oils, the krill helps create the resolvins and protectins that shield the brain and the eyeballs, the retina of the eye, from inflammation and damaging cells, etc. So there's a great benefit to taking krill oil. I do eat fish. My wife is amazing with fish. She goes out and she buys great fish, and she knows how to cook it, and it's just amazing. It's delicious. It's the best thing on the planet. I'd rather have fish anytime. I don't eat red meat, but it doesn't matter. That's more of a moral issue. I don't want to eat those mammals. But as far as flavor, the fish just hits the ball out of the ballpark compared to meat. But I take my krill. I take it frequently. I take 3 capsules a day with food. You always take krill with food. So thank you for tuning into the Invite Health podcast. And like I said, I do like fish oil capsules. And of course, eating fish is great because you're getting all the protein and a lot of other things in there, minerals like magnesium. But krill, to me, even though I think fish oils are great supplements, I think krill is superior. It has more benefits and greater advantages. Thank you for tuning into the Invite Health podcast. You can find all of our episodes for free wherever you listen to podcasts or by visiting invitehealth.com/podcasts. Please subscribe. Please leave us a review. You can follow us on Facebook, Twitter, and Instagram at Invite Health. We'll see you next time on another episode of the Invite Health podcast, and thank you so much for listening.